We see a lot of patients that have had gum grafting done in some other office, and then the recession reoccurs over the next 2 or 3 years. A lot of times that's because the source of the recession was never addressed. In so many cases today, the recession is either caused by clenching or grinding your teeth, or it may have been by brushing improperly. In the event of clenching and grinding your teeth, what you can do, you can actually test this on yourself. Look in the mirror and rub your fingernail on the neck of your teeth where you have recession. If you have a little notch at the neck of your teeth, that's from clenching and grinding. You're clenching and grinding your teeth so hard that you're causing them to wiggle in the socket. That wiggling motion is creating this notch at the neck of your teeth, and that notch is unstable. And so what will happen is your gums will recede away from that unstable area. Also, that if it doesn't cause gum recession, it can cause your teeth to break. And if it doesn't cause your gum recession or your teeth to break, it can cause headaches. Just because you're clenching and grinding that one area, it causes your muscles in your face to overwork. And then you get these tension headaches. If you get headaches in your temples, headaches in your forehead area, those are typically tension headaches. And a lot of times that's due to your bite. So to correct that, we use a procedure that actually measures how hard you bite and where you bite on your teeth. We do it as part of what we call a bite adjustment. I have you bite on this computer sensor, and this sensor will create a digital image on our computer that we can see that shows us where your teeth contact, how hard they contact, when they contact, and the pattern of your bite. And we can adjust and change that so that when you do clench and grind, your teeth don't wobble anymore. And if they don't wobble anymore, if I go in and correct your recession, the recession won't reoccur. Same thing for headaches. You know, if you're having tension headaches, especially if you have headaches every day, or if you're taking Advil and Tylenol all the time because you have headaches, a lot of times that's clenching and grinding again. Doing a simple bite adjustment, I'd say in about 3/4 of the cases, will make it where you clench and grind less, and so your frequency of headaches goes down. There's other things we can do to manage your bite as well. In some patients, about 1/4 of our patients, we put them in night guards. Night guards are these appliances you wear mainly when you sleep, because people have a tendency to clench and grind the hardest when they're dreaming, during REM sleep. And so we'll put them in an appliance called a night guard that'll help them relax their muscles while they're asleep. And then another approach that we use quite a bit is Botox. You know, you've heard of using Botox to correct the wrinkles in your forehead and along your eyes, things like that. But you know, the muscles that cause you to clench are these muscles on the side of your face. They're called your masseter muscles. And then the muscles on the side of your head are called your temporalis. I can place Botox in those muscles and they still work. You can still smile, you can still chew, you can still do all those things, but you'll have a tendency to clench and grind less, and your headaches typically go away. It's super effective. And this is really cool too. When we're applying Botox to those muscles tend to get a little thinner over the course of a year. When you look in the mirror, you'll notice that if you have a square jawline on the back of your jaw, that jawline will tend to smooth out a little bit. A lot of people like that they don't have such a square jaw. If we place a little Botox in the muscles you're clenching and grinding the most with, those muscles tend to thin out a little bit, and you'll have less frequency of headache and less intensity of headache as a result.